black hole. Just every month we seem to collect or request more, and we transfer more. So my question is, what's the cause? Do you know what it is? Is it just a function of the population? Is it the type of healthcare that's needed? I mean, it seems to be almost out of control. So just needs data, some data needs to be collected. Also, budgets require trade-offs. And I'm just curious, as we get into the budgetary season, what are we going to trade off from a public safety standpoint to pay for inmate health care? So a concern there. Do we need to renegotiate the other county rate to cover some of that health care increase? And then, unfortunately, what's the projected effect on the tax rate in 2027 with all these inmate health care? So that's all I have. Thank you.
Thank you. Thank you for letting me come here today, and I'd like to try to answer as many questions as possible. First of all, I'd like to make sure that everyone of the public knows that our jail housing agreement with other counties for inmates from other counties, this has nothing to do with that. We do not pay, for the record, we do not pay for any out-of-county inmates' medical expenses. We only pay for the expenses that we incur for our local prisoners. So a lot of people have speculated and wondered and have guessed that, you know, we pay everybody's medical. That's not true. That would be silly. So anyway, I wanted to just make that statement at the front to clear up. So our out-of-county inmate housing rate, sure, we can look at that when those contracts come up to see if we need to raise that, but it doesn't impact our medical in the respect that we're asking today for these budget transfers. And all I can say is I hate it worse than anybody in the room that we have to transfer this money. But the sheets that I've given you detail, there's 60 line items on there that are current expenses that are in excess of $1,000 per inmate per event, if you want to call it. And most of these involve emergency room visits to the hospital. We've had some big expenses from inmates having to be transferred out of town to Houston. We've got several that are on HIV meds that cost $5,000 each per month. And we've had, inmates suffer strokes. We've had that had to be transferred out of town. We've had cancer. We've had surgeries that have been required. We have an inmate that we're currently sitting on that we have been told he's going to have an ablation. And we've gotten estimates on that between $44,000 and $80,000, quite a range, but still very expensive. So these expenses are from inmates being sent outside the jail that are on your sheet that we can't control. And unfortunately, at the jail, we're dealing with the most unhealthy individuals in the county, people that suffer from lack of access to health care, drug abuse and drug addiction, mental health problems, the people that aren't living the most healthy lifestyle. And so they land in our lap. And once we have them, we have to take care of them. So I would not suggest that there's anyone in this room today that would think that we should deny anyone health care or that we should skimp on health care for any inmate. This is a humanitarian deal. We have to take care of these people. So the jail and the sheriff don't really have a solution to what the expenses are. When these things happen, we have to send people out to get treatment. Where we could use some help is the people that are sitting in jail awaiting trial that have these conditions that we try to highlight and emphasize. If the judicial system could move on those, speedier or to make them a higher priority, I believe we could reduce the risk that we have of incurring these kind of expenses. But obviously we've had to blank out the inmate's name and all that kind of stuff on the sheet that I've given you. But all I can say is we're here, we work every day very hard to try to control our cost. But when these people fall out on us, and high blood pressure is a big problem in the jail. We have over 190, which is half of our county inmates are on long-term medications. So we're medicating, the jail dispenses hundreds of thousands of doses of medicine to the inmates each year. And so once they're in jail, we're responsible for their medication cost. And so our pharmacy bill is there. So anyway, I'll be glad to answer what questions I can. I don't know the specifics on each one of these cases that you have before you here, but this is just a snapshot of what we're dealing with on inmate health in the jail. It's the physical condition of these people is, for the most part, very bad. And like I said, when you got 195 people that are on long-term medications that we have to dispense every day, that tells you that, half the population of the jail is suffering from some kind of acute disorder, some kind of disease that we're treating there in the jail. And then when our treatment is not effective, then we have to send them to the hospital. And then we are fortunately paying the indigent rate, which you can see how much of a discount that gives us on these bills. So anyway, I'll be glad to entertain any of your questions.
I would address the budget issue. Action on authorization for the sheriff's office to apply for a county feral hog abatement grant for the Texas A&M Agri-Life Extension Service Wildlife Services Program to purchase pig brig hog traps for loan to county landowners. Sheriff, you want to add something to this?
On the agenda, the state of Texas, through the Texas A&M Agri-Life Extension Service and their Wildlife Service, has put up a grant opportunity for counties to apply for funds to help control feral hogs in the county. So we spotted this grant, and with the sheriff's office having an animal control officer, and we loan out dog cages and raccoon traps and stuff like this to help landowners deal with the varmints that inhabit their spaces. We are requesting for permission to apply for this grant, which will allow us the same loaner program like we do with our current traps, and we will have our animal control officer will get him trained to help oversee the proper installation of these devices. I know of a landowner friend of mine that has one, and he removed 200 hogs from his property in 1 year with this. Commissioner Berry and I exchanged some communication over the weekend, and I believe some of his people put one up, and they called 11 on the first try. So, just to expound, this trap is a passive trap. It's a net, and they push up underneath the net. And once they get inside the net, they're caught and they can't get out. It's not like one where the gate slams behind them and catches them. So it allows more to keep coming. So you can catch 10, 15, 20 or more. However many show up that are hungry, that's how many you catch. So if we receive this grant from the state, we'll deploy these to landowners around the county. We'll have we can open up a list, or we'll work the logistics out of that if we get the grant. But anyway, that's what it's for. And pigs are major problems here, even in town. There's some damage that they do inside the city limits as well. So that's the story on the pig eradication grant request.
You're gonna be serving a lot of bacon at the jail?
I don't know. I think the buzzers will be real happy when those pigs get caught somewhere. I don't know what the landowners are doing, but we'll oversee that as well.
How much do we anticipate the grant to be?
The grant submission was for $12,000. Is that what I
Something
sent
like
you? Yeah, around $12,000.
How many traps will that get you?
They'll get us 3 traps.
Motion to approve.
I second. I'm telling you real quick before you vote, it's the real deal. I mean, my neighbor sent me a text the other day, the government's sticking $35 million into this. And I just figured it up on the phone. The only thing that makes me mad is you're doing this now, and I done went and bought one about 6 weeks ago. But that's
Made it pretty low.
point. But anyhow, they work. But at that price, if you, $35 million would buy you like 11, 12,000 of these things, these traps. And if you figure you catch 200 hogs, but that's just a fraction of the hogs in the state of Texas, but it still helps. I mean, like me trying to raise hay meadows, you gotta get them out, or you can't get in there and produce hay to raise cattle, period.
Sure.
But it's a very good deal, but you got a motion in a second, so get after it.
Have a motion and a second from Commissioner Sprinkle. All those in favor say aye.
Aye.
All opposed? Motion passes.
Okay, thank you, sir.